Hello, everyone. This is me, your instructor, Joe Zelinki, and I'm joined by Rebecca and Larry, some colleagues of mine. Rebecca, tell us a little bit about what you do.
Hi, my name is Rebecca Rotenberg. I'm a registered occupational therapist. I work in a skilled nursing facility.
And Larry?
My name is Larry Jaffe. I'm a physical therapist, certified athletic trainer, and sports clinical specialist, and I work in various settings, including sports medicine.
I wanted to take this opportunity for the three of us to talk about the interdisciplinary approach when working with individuals with mild traumatic brain injury and concussive syndrome. Larry, go ahead and advance the next slide. Larry will now give us a description of concussive syndrome.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
So a concussion really is going to be usually a injury to the head, but it also can be where there's no contact because it actually be where the brain, due to a sudden stop, actually hits the inside of the skull. And so you should think about a concussion as more of a functional injury, not really the head injury. The head injury is the initial part of it, but the concussion is this secondary issue that comes once the brain gets injured.
That's a great definition of what happens, and I really liked the visual component to show that tearing and shearing that occurs once the structures within the skull start moving around due to the impact.
So here are some common concussion signs that are observed. The patient will be unable to recall events prior or just after the injury. They might appear dazed or stunned. They forget some instruction or is confused about any assignment or position or unsure of the game, score, or even the opponent they're playing. They will be moving clumsily, more than normal. Their answers to questions really slow down. Most common people think about concussion having where they lost consciousness, but not all concussions do they lose consciousness. And then they might have some mood or behavior or personality changes. Now, the symptoms that are reported are the nausea and vomiting, balance problems, dizziness, double or blurred vision, bothered by light or noise, feeling sluggish, hazy, or fog-like or groggy appearance, confusion or concentration or memory problems, or they'll say, I just don't feel right, or I don't feel me, kind of thing. And so the question is, where do we find patients that have concussions, or where do they occur? And it really can occur anywhere where any kind of head injury can occur. During sports is the most common. It can happen in schools, work sites, home, and now even car accidents. But realize that the injury can occur at a different site, but us as healthcare practitioners might be the first healthcare practitioner to realize these signs and symptoms.
And that was one of the things that I had put in my other discussion, that very often a lot of healthcare professionals are not trained or sensitive to these very subtle changes in functioning. Therefore, we have to go through the assessment process in order to identify these skill sets that are affected for during a concussive syndrome or a mild traumatic brain injury.
Like, for example, if you're working in a school setting, you may have not seen the injury occur, but the next day or two, you might be in a hallway seeing someone acting differently, or a teacher might say that their student kind of is not acting as they normally are. And so sometimes we're the ones that will step in and say, could they have a concussion?
All right. What do we have up next, Larry? So in addition to concussive syndrome, one of the biggest populations that go undetected for these very reasons is the diagnosis of mild traumatic brain injury. Usually the person will show with those initial symptoms where either they have a very short loss of consciousness or maybe no loss of consciousness. So everybody might get up and brush themselves off and say, well, no, I'm doing fine. But this is particularly important that we recognize and ask these questions to drive the appropriate assessment of an individual who may be susceptible to concussive syndrome or mild traumatic brain injury. Once this is done, we may refer to the appropriate professionals such as neuropsychology, neurologist, and all of us in that interdisciplinary team. I think we've already pretty much hit all of these as far as the diagnosis. It's really being sensitive that even though they may look fine, there are certain factors that may come into play in terms of the loss of consciousness was less than 30 minutes. And sometimes the individual is seen by EMT professionals, but they don't actually go to the hospital. But yet they still present with those symptoms. And we may catch them within a school setting, or they may be referred by the neuropsychologist later on. Rebecca, why don't you go ahead and give us a description of what you see or have seen within your practice and how occupational therapy plays an important role.
So in occupational therapy, the goal really is to get our patients or clients back to their independent level where they were before, and that can include self-care, cooking, cleaning, driving, returning back to work, or in the case of returning back to school. So that's where OT comes, is it's a transition between where they are and going back to where they were before. So whether that's school or work. In my practice, I've seen patients with mild TBIs. I end up coming across that more than I do specifically concussions. And I've seen both from the mild and even from the severe TBI, stroke and all of that. A lot of the similar symptoms of memory loss and irritability, and working through that so that we can get them back to being independent and finding ways to work around them and find adaptive ways, adaptive strategies, and teaching them adaptive strategies or compensatory strategies, either or, depending. Adapting the environment if we have to, but if we can, we try to compensate for it too.
And in outpatient programs, Rebecca, occupational therapy plays an important role in potential transitioning of returning back to driving, with driving clinics and driving tests that are preempted once referred by the neuropsychologist or the neurologist.
Correct, and there are occupational therapists that have that specific training, and it's a completely separate set of assessments than what we would do in the skilled nursing side. We can do some of it, and we can refer, and we can send what our findings are, but when it comes to driving, there are specific clinicians that are trained with that have to be the ones to do that type of assessment. Yeah.
What do we have up next, Larry? So in terms of the three of our disciplines, physical therapy, well, actually four: athletic training, occupational therapy, speech language pathology, we sometimes, as Larry had already mentioned, are at the forefront of catching these undetected symptoms. In some of the ways that we also facilitate the improvement is to work in terms of a team approach by completing home evaluations, community reentry assessments, looking at how someone can navigate in a terrain that they're not used to, and being able to do that safely. By completing all of these things together, we report back to the team and use any other resources that are needed. I just wanted to give you all the opportunity to see how important the role of an interdisciplinary team and practice with that collaboration. Always, even though you may work independently with an individual, you always need to be in contact at some degree and with regular frequency with your other professionals in order to treat most populations, but particularly this type of patient population. Thank you very much, Larry. Thank you, Rebecca. And I'll leave it and close to that. Any final remarks from Larry or Rebecca?
Just that realize that concussions, you don't need to be unconscious to have them. As mild as they are, the more you have them, the more the symptoms get worse. So someone who may have had 4 or 5 mini concussions, as they call them, could be at a higher risk than someone that had just one bigger concussion.
Rebecca, any final remarks?
And I would say to just the same thing with the traumatic brain injury. Some of them can be mild, some of them can be really severe, and really to just keep all of the different symptoms in mind, and to keep that in mind with your approach too, because some of our patients and clients will be irritable, and you have to kind of just remember what the symptoms are, and that they can vary from mild to severe.
Right. And the biggest thing, takeaway I know as a speech language pathologist is just because someone scores well on a test doesn't mean that they're not having difficulties. Listen to the individual, the caregivers, or anybody around who may report, and be sensitive to those very informal clinical observations that we can make with that diagnosis.
Especially if there's a change in their normal activity or normal personality in a short time.
Well, thank you very much for your time, and I look forward to sharing this with the students.